Are you frequently asked, are you tired or mistaken for being older than you are? Well, the good news is there is help. So joining us today is Dr. Blvd with more on some simple cosmetic procedures to keep you looking young and vibrant. Dr. Blvd, thank you for being in with us this morning.
Good morning. Great to be here.
Yeah, so, I mean, this is pretty common, is what you were telling me in the break, is when people say, you know, I'm starting to feel like I'm looking older, getting eyelid surgery is pretty much the first step.
Often it is, because our eyelids age faster than the rest of the face. You know, the eyelid skin is very, very thin, and with blinking and rubbing our eyes and smiling, you start to get lines, creases, and extra skin, really even sometimes in the 30s and 40s.
Right, and so this is a pretty routine procedure to come in to an office like yours and to come get some surgery done to your eyelids, because it can affect both the upper and lower that you want to get help with, I'm assuming.
It can, and often people will notice their upper lids start to look heavy or droopy, or they might look tired. That's something that people will say, gee, I look tired all the time, even when I'm not. And that can be the extra skin and fat around the eyelid. So these things can be improved, you know, quite simply through outpatient surgery.
Okay, and what's the recovery time on a surgery like this?
So the good news about eyelids is surgery is very quick and there's very little discomfort. But eyelids are the skin is thin, so it swells easily. So you have to use a lot of ice, and you can anticipate some swelling around the eyes for a week or two with that procedure.
Okay, and you were telling me as well that eyelid surgery can actually help affect your vision, to help improve your vision.
Yeah, it's an important point. You know, the upper lids, when they get heavy enough where it starts to weigh down the lid or droop over the edge of the lid where you can't see the eyelashes, as one of the cases we showed this morning, then it does start to affect your peripheral vision, and sometimes insurance will cover the cost of upper eyelid surgery if it's going to help you see better.
Because it becomes medical at that point rather than cosmetic.
Right, if it's going to help you see better, it can be deemed medically necessary, yes.
Right.
Yeah.
Okay, what do people need to consider if they say, well, you know, I don't really like the way that my, you know, under eyes or my eyelids look? What are some of the things they need to consider, you know, before coming to see you?
Well, I think just a consultation with somebody who does a lot of eyelid surgery is really important. I mean, that's a starting point. You can kind of learn about the procedure, see if you're a good candidate, you know, that's really about it. It really isn't that difficult. It's the most commonly performed facial surgery annually in this country. So eyelid surgery is very, very common and can be really helpful not only to help you see better, but look better.
Right. And are the results lasting, or is this something you'll need touched up over time?
It's rare to have to repeat it. Sometimes we'll see patients 20 years later who will have a little bit of loose skin or something and have a second procedure. But for most people, it's one time only, yes.
That's good to know. Very good. And you saw some of those before and after images we showed you on our screen. We'll also get those up on our website, winknews.com. Dr. Blvd, thank you for being with us this morning.
Thank you. It's been great.
All right. Wonderful. We'll be right back with a check of your weather, traffic, and this morning's top stories. You're watching Wink News This Morning on WXCW.